Thank you again so much, Dr. Forbes, for being here today to talk to us about your presentation at ASH. Would you like to begin with an introduction of yourself and what you do?
Sure. My name is Catherine Forbes, and I am a clinical pharmacy specialist at Roswell Park. Specifically, I work in the lymphoma and myeloma space.
Terrific. And thank you again for your time today. To begin this interview, I wanted to ask if you could give a brief overview of your presentation regarding social determinants of health on survival outcomes in multiple myeloma.
Sure. So, we did a retrospective analysis of patients who were treated at our center. It went back to 2013, and we looked at social determinants of health. So, what we used to determine this was US Census data and also something called the Area Deprivation Index, or ADI. Specifically, we used a tool out of the University of Wisconsin, but there are different tools available that you can use that take things into account, like education, living conditions. Even things like having access to a car or public transportation, how crowded your housing is, income, and then mortgage or rent costs. Those are some different factors that can go into these types of tools. And that will scale a patient from 1 to 5 for the specific University of Wisconsin ADI index. So 5 is the most disadvantaged population, whereas 1 would be the least disadvantaged population. And when we correlated all the data, we found that patients who had higher levels of deprivation and also lower income did have a lower progression free survival and overall survival compared to other patients who had a lower ADI or who had less deprivation and those who had a higher socioeconomic status.
Terrific. And I was going to ask you about the ADI, the Area Deprivation Index. How does that work, and how does it help with what you're trying to study in this?
So it works by taking all of those factors. So just to highlight things that it looks at would be like education, occupation, um, unemployment, your housing conditions. Some types of tools even will look at access to food or nearest grocery stores. And they break it down by even to the neighborhood level. So the one that we use was looking at census block groups. So you're really looking at people in a very specific area so the data is accurate to where they're living and kind of what's around them. Um, and that helps us to determine kind of a patient's socioeconomic status. And depending on the number that they have, they could be more or less disadvantaged.
You might have started going into this, but I guess if you have more to say about some of the results you were able to present at ASH.
Sure. So when we looked specifically at our results, we looked at overall survival based on income. So this was for all patients, and patients who had a higher income did have a significantly high overall survival. When we broke that down based on area deprivation index, patients with a score of 1 to 3 and 4. So again, our less disadvantaged patients did have a significantly higher overall survival. Then we looked specifically at patients who had received transplants, as transplant can be part of a standard part of a multiple myeloma regimen. And again, we saw that that trend carried through to transplant receiving patients. So those who had less disadvantage had a higher overall survival after a transplant. We also took into consideration patients' cytogenetics. So there are things just at baseline based on your DNA that can make you a higher or a lower risk multiple myeloma patient. And interestingly, we found patients who had high risks. Fish is what we looked at for this specifically. So just a little background on that. If you have a high risk fish, you are more likely to have a poor outcome just based on your DNA and cytogenetics. But our patients who were high risk, if they had a higher income, still outperformed the standard risk patients who had a lower outcome. So this really showed that socioeconomic status and those social determinants of health really do make a huge impact in myeloma care.
Definitely. And how can clinicians address the social determinants of health in their practice?
So we do it through a couple different ways, but when every patient comes into clinic, they are asked a multitude of questions through various questionnaires. So these include domains like access to food, domestic violence, stable housing. Um, and when we go through these questionnaires, when they're being roomed, usually it's either like a nurse or a PCT asking these questions. If they get flagged, and we can set them up with resources such as social work, or sometimes they just need somebody in pastoral care. So using those kind of screening tools helps us to identify patients who may be at higher risk from having those adverse effects of social determinants of health. And we do that at every visit. They get asked these standardized questions. So it helps us kind of follow them through their treatment journey, and identify at any point in time if they're becoming at risk for these social determinants of health factors that could impact their outcomes.
Terrific. And is there any plans to continue the study or expand the study at all?
I would love to do a follow up. So, like I had mentioned earlier, this went back to 2013. Um, in the next couple of years, I think it would be really important to go back and look, from the time point that we stopped to that newer, later time point. Um, I do believe that as more knowledge is gained about social determinants of health and we understand the impact that it has more in our patients, we can start to better identify places that we can make changes. And so this project was kind of the first step in saying, starting back in 2013, we identified this issue. So over the past 10, 15 years, how have we been changing, and hopefully how have we been positively changing to the point where we can see that there is a positive difference in the future.
Definitely. And final question I wanted to ask you is kind of on the patient side of things. If there
Mhm.
was a patient that, saw your presentation or read about it, and they were wondering how this research could potentially affect their care, what would you tell them?
So, one thing to keep in mind is that this is a retrospective study. So, this data that we're looking at was in the past, although social determinants of health definitely do still come into play now. We are taking steps to better identify patients who are at higher risk. So I would say if a patient is concerned about that, or if they're looking at some of the factors that play into social determinants of health and they're resonating with them, then definitely they should be bringing it up to the care team. We are getting better educated and trained on the social determinants of health and how it impacts healthcare. Um, so patients should never be afraid to say, hey, I have an issue with transportation. I have an issue with getting healthy food. I have an issue with paying for my medications. We have so many resources available. Since I'm a pharmacist, just speaking from the pharmacy side of it, we have a whole team of people that are able to help our patients. So they should definitely never be afraid, to say, hey, I'm one of these patients that maybe needs this kind of help, and to be truthful and honest when they're answering those screening questionnaires at their appointments so that we can make sure that we're giving them all the resources that are available to them.
Absolutely. Well, thank you so much again for your research and taking the time today to explain all this for us. Thank you, Dr. Forbes.
Thank you very much.